Classification of nerves. What is the need to classify the nerves? The nerves are classified to facilitate two processes. The first process is knowing the classification of nerve help us to determine its physiological role. The nerves may be sensory, motor or secretomotor. So we know which role is performed by which type of nerve. Secondly, different physiological and the pathological condition affect different type of nerve. Some may be specifically affecting the sensory nerves while other may be affecting the motor component. So the classification help in this process of knowing the nerves better. Different terminologies are used in relation to the nerve fibers. They may be called somatic or the visceral nerves. Somatic nerves carry the sensation from the skeletal muscle of the body, whereas the visceral nerves carry it from the internal organ. Similarly, we may have the cranial and the spinal nerves. As the name suggests, those arising from the brain are the cranial ones, and those arising from the spinal cord are the spinal nerves. Then we have motor nerves, impulses, which are motor in nature from the CNS to peripheral effector organ like muscle, glands and blood vessels. Whereas sensory are the reverse. They carry the afferent nerve signals from the periphery toward the central nervous system, that is from the receptors to the central nervous system for the analysis of the signals. Adrenergic, which secrete norepinephrine, and cholinergic, which secrete acetylcholine as a neurotransmitter. Then we have the myelinated and unmyelinated. When we talk about the classification of the nerve, it can be classified in three headings, that is letter classification of Erlanger and Gasser, numerical classification, and the nerve classification, which is based on susceptibility of nerve fibers to hypoxia, pressure and anesthesia. So let us understand each of them one by one. The most commonly used or the best known classification is based upon diameter and conduction velocity of the nerve, and it is known as letter classification of Erlanger and Gasser. We know that fibers which are large diameter fibers, they conduct impulse more rapidly than the smaller one. It is because of the presence of myelin sheath, and this myelin sheath increases the speed of conduction approximately 6 times, whereas in an unmyelinated nerve fiber, the speed is proportional to the square root of the diameter. So when we call letter classification of Erlanger and Gasser, it is based upon the letters A, B and C. That is also representative of the alphabets A, B and C based on the diameter and conduction velocity. We can see here the diameter of A fiber is greater than that of B, and which is greater than that of fiber C. And similarly, if we talk about the conduction velocity, we said in a myelinated nerve fiber, for example A, the velocity will be 6 times that of the diameter. So the conduction velocity, you can see A alpha is 70 to 120. And if we talk about delta fibers with a diameter of 2 to 5, 6 times will be 12 to 30 meters per second. And then we have the B fibers and then the C fibers, which are unmyelinated in nature, and the conduction velocity will be the square root of the diameter. These are the functions that are different for fiber A, fiber B and fiber C. So if we talk about the fiber A, which is the fastest conducting type of fibers, have a diameter of 12 to 20 micrometer and a conduction velocity that is 6 times approximately will be 70 to 120 meters per second. These A fibers carry both the motor and the sensory function. They are motor type A fibers and sensory type of A fibers. So, you know this famous cricketer, A.B. de Villiers. So we can use it as a mnemonic to remember the classification for the sensory A fibers, that is A alpha, A beta and A delta sensory fibers. So each of these sensory fibers have a different role to play. First, as you can see, A alpha fibers. These A alpha fibers carry the impulses from skin, joints and muscles. And since they are carrying it from skin, joint and muscle, they are proprioceptive in nature and also bring some of the sensation from the gut also. A beta are the impulses which are carried are touch and pressure. Then we have A delta fibers which carry fast pain fibers from the thermoreceptors and nociceptors and also touch sensation. So A alpha fibers, beta fibers and the delta sensory fibers. Then we have motor type of fiber which carry the motor function. A alpha supplies the extrafusal fibers as you can see in this figure. A gamma, you can see it is supplying the muscle spindle which is responsible for stretch reflex. Then A delta, you can see some of the collaterals of the A fibers innervate some intrafusal fibers. Talking about the B and the C fibers, you can see in this diagram, this is representation of autonomic nervous system pathway where a nerve fiber that is arising from the lateral horn of the spinal cord is traveling up to the level of ganglion. The preganglionic fibers, as you can see, carry a myelin sheath. They are preganglionic fibers type B of the Erlanger and Gasser classification. And then postganglionic fiber, you can see a small neuron that is arising, and the postganglionic fibers are type C fibers that do not have a myelin sheath. So the diameter of preganglionic fiber is 1 to 5 because of the presence of myelin, and there is no myelin sheath in type C fibers and they have a diameter of 0.2 to 1.5. So these type B nerve fibers, they mediate the autonomic responses and the conduction velocity is 3 to 15 meters per second. They are preganglionic in nature, therefore when they carry the efferent fibers and the afferent fibers from skin and the viscera, they are responsible for various autonomic function related to heart rate, blood pressure, respiration, GI peristalsis. The type C fibers are the smaller fibers which are postganglionic in nature and have a conduction velocity of 0.5 to 2 meters per second. They carry the slow pain sensation and also some sensation that are coming from the viscera. Another classification of the nerve fiber is the numerical classification according to the Roman numerals 1, 2, 3 and 4. You can see in this figure, type 1A fibers are the fibers which are coming from the muscle spindle. Here you can see the fibers from the muscle spindle are going back to the spinal cord. They are type 1A fibers. Then we have type 1B fibers which are coming from the Golgi tendon organ. And these fibers are carrying the impulses to the spinal cord. Then we have fibers which are fiber 2. They are the afferent fibers which are carrying the impulses from muscle spindle and also carrying the impulses of touch and pressure. 3 carries the impulses from pain and temperature receptor, that is thermoreceptor and the nociceptors, whereas type 4 carries the sensation from the pain receptors. Then the final classification that we can talk now is the classification which is based on susceptibility of the nerve fiber to 3 conditions. 1. Hypoxia, 2. Pressure and 3rd is the local anesthetic. First, hypoxia, the most susceptible fiber is type B fibers. To pressure it is type A and for local anesthetic it is type C fibers. So when we talk about hypoxia, we said that type B are more susceptible and we also know that type B fibers are the preganglionic fibers which mediate the autonomic responses. So whenever this hypoxia affects these type B fibers, we have a condition that causes the dysfunctions of autonomic system related to blood pressure, heart rate, and respiration. And when we talk about pressure, the most commonly fiber affected is type A, and we know that type A fiber carries both the sensory and the motor fibers. So you must have experienced on prolonged sitting, the effect is on type A fiber, that is pressure, and the symptoms that are related are paralysis, temporary paralysis because of the loss of control by these fibers, mainly affecting type A fibers which are carrying touch and pressure sensation. One such example is Saturday night palsy, in which a prolonged pressure in the region of axilla results in tingling sensation and temporary paralysis in the hand which is being affected. This can be seen in prolonged sitting, sleeping with arm under the head, which produces a tingling sensation because touch and pressure are being affected. There is another syndrome which is known by the name of carpal tunnel syndrome. It is because of the compression of median nerve during at rest, resulting from hypothyroidism, leading to the compression of the nerve and resulting in numbness or pain along the region of distribution of median nerve. Then we said that local anesthetics are more susceptible. Type C fibers are the most susceptible to local anesthetics. And this is so because the length of the fiber, the node of Renvier, are smaller in type C fiber as compared to type A and B. Therefore, local anesthetics are able to influence more the type C fibers as compared to some other fibers. So this has rather been proved useful in local surgeries because these type C fibers carry the sensation of slow pain and also temperature sensation. So local anesthesia is used as a measure to cause block of conduction of nerve in type C fiber for various surgical procedures. This slide shows the final summary, that is classification of the nerve fiber. One side, on the left hand side we have Erlanger and Gasser's classification. On the right hand side we have the numerical classification. The Erlanger-Gasser's classification A, B and C fibers, A alpha, beta, gamma and delta you can see. The B are the preganglionic sympathetic and C are the dorsal root and the sympathetic fibers which are postganglionic in nature. And then numerical we have 1A and B, the 2 fiber carrying touch and pressure which is overlapping with the A beta, and A delta overlaps with type 3 fibers and type 4 is overlapping with C type of fibers in the Erlanger's and Gasser's classification.